I'll look at the next syndrome, which is kind of like related to hypertension, and this is what is known as the Liddle syndrome. Okay, Liddle syndrome. So let's quickly look at what the Liddle syndrome is. Okay, so you can see this. The titled Liddle there. We have the Geller syndrome, but we're looking at the Liddle syndrome. So what is it and what is the mechanism, or what are the bases, pathophysiology? So it's actually a rare genetic disorder, and it causes hypertension in young people. Now, this is because sodium handling is not going on as it should. So it's sometimes called pseudo-aldosteronism because it mimics as though there's excess what? Aldosterone. Okay? So sodium handling is not going on very well. So causes, there's mutation in genes that are encoding for epithelial sodium channel in the kidney's distal tubule. So this epithelial sodium channel become too active, leading to excess. Any sodium that comes to the tubule to be reabsorbed. Any sodium that comes to the tubule will be reabsorbed back into the body. So there's increased blood volume. Of course, if sodium is absorbed, it pulls water with it. So this leads to hypertension, and there's a loss of potassium. So this leads to hypokalemia. There's metabolic alkalosis due to hydrogen ion loss. So that's what we have. So clinical features is there's hypertension in a young person, okay, which is not supposed to be. Then there's resistant hypertension. You are treating with standard drugs and medication, but it's not working. Hypokalemia. There's muscle cramps, fatigue, arrhythmias. Then if you do a family history, you get to see that there's family history of inheritance. Diagnosis is you measure the blood pressure and you see that renin levels are low, okay, aldosterone levels are low, hypokalemia, metabolic alkalosis. Then genetic testing to now check that there's mutation in these what epithelial sodium channels, ENaC. Okay. So management is what amyloride or triamterene. You can see it here, triamterene. They're actually potassium sparing diuretics because there's loss of potassium greatly. So you have to give diuretics that will remove fluid but will retain potassium for the good of that person. So to correct the sodium retention and hypertension. Then also spironolactone and all those, also the eplerenone, the lifestyle where the salt that the person is taking they have to reduce and keep monitoring the potassium levels. They screen the other family members because there's a risk of them actually carrying the condition.